all making your minds up as to who should be representing you at different levels of government. If you look at everything that's going on right now in this country, I'm sure no matter where you side on so many issues of importance, you have some very passionate personal beliefs about the direction our country should head. I get along with the incumbent well. Our offices work well together. We overlap. I represent the 3rd Senate District. But we disagree on the path that our country should be heading. I think that we can do more to grow our economy, create more good-paying private sector jobs here on Long Island. I'm someone who strongly believes that we need to repeal and replace Obamacare, that we could do a better job securing our borders and our interests abroad. We do a better job fighting for our veterans who have fought for us, and for our children who are in school who we want to provide a quality education for. I believe in higher standards, but I don't believe Common Core is the answer. These debates over the course of the next several weeks give us an opportunity to compare my position on so many issues that are important to you and my opponents. And if you believe in the Obama, Pelosi, Bishop agenda, I would encourage you to go out and vote for it. I believe that our country's heading in the wrong direction. And it's not about where you see Republicans blaming Democrats and Democrats blaming the Republicans. I think there's enough blame to go around to all of them. The dysfunction that is plaguing our nation's capital, the fiscal insanity. They've passed one budget since 2007. The partisan bickering, the political posturing, people who want to stay in office at all costs. Their first, second, and third priority is to get reelected. There's a security that they feel that they don't want to give up. So they stay there for a really long time. To me personally, I believe in actually passing term limits. But you know what, even in the absence of passing term limits, we have that opportunity on November 4th. You can term limit any person who's in office who you don't believe should stay there any longer. And you know what, if you keep reelecting the same congressman over and over and over again, you can't ever expect a different result. If you want to change Washington, there's no way to change it without changing the people we're sending there to represent us. I was born and raised on Long Island. I grew up here in Brookhaven, K through 12, in the Wayne Floyd School District. My daughters go to the same elementary school that I went to. I served in the United States Army. I was a military intelligence officer, a prosecutor, magistrate, deployed to Iraq with the 82nd Airborne Division in 2006. I still serve today as a major in the Army Reserves. I've been representing the 3rd Senate District since January of 2011. I was elected in November of 2010. And when I was running for the first time, I said, if you elect me, this is what I'll do. I'll work as hard as I can to repeal the MTA payroll tax. I'll work as hard as I can to eliminate the saltwater fishing license fee, or to protect our veterans for post-traumatic stress disorder. When I was elected, I obsessed over delivering over those promises I made when asking for votes. I knocked on 12,000 doors when I first ran in 2010, talking about these issues and others. When I was able to run in 2012 for my only re-election, my banner was promises made, promises kept. Because we repealed the MTA payroll tax for 80% of employers. We eliminated the saltwater fishing license fee. We enacted the nation's strongest property tax cap. We created the PFC Joseph Dwyer program for our vets with post-traumatic stress disorder. We cut middle income tax rates to the lowest level in 60 years. And you know what? We have Republicans and Democrats sharing power in all of it. There are liberals, moderates, and conservatives. Republicans and Democrats who sit down at a table and try to find common ground to move our state forward. And I believe that there are good people in office down in Washington who want to be problem solvers. There is no way that when you have Republicans and Democrats sharing power, that either party is going to be able to get it 100% of their way all of the time. Unfortunately, we don't see a lot getting done to be able to solve the problems that we're talking about. And I think we need a change of direction. I have a lot of energy and ideas, and I believe it's time for new leadership. We can have a more stronger voice representing us, and we would be benefited with a fresh perspective in January. So I'd be honored to have your vote. That's why I'm here tonight, to ask for it in person. I'd be happy to answer any questions.
We'll take questions for about 10 or 15 minutes. Please no statements, just questions. We appreciate it. First question.
Hi. I thank you so much for coming out here tonight. great opportunity to see and hear your stand on things. I had the opportunity of meeting you in May in Albany as myself and several other families who have lost someone to addiction come up and try and get some laws passed. And in the midst of, as everyone knows, Channel 12 and Newsday is doing a big spread on the heroin epidemic on Long Island. I'd like to know what your stand is and how you would approach coming to some answers and to some solutions.
Well, after we met, thank you for the question. After we had met, we passed 24 different pieces of legislation up in Albany, and I certainly give a lot of credit to you and your group and advocates from all across the state, especially here on Long Island, where we have a huge challenge that's facing us. Whether it's praying for those who haven't been impacted yet, thinking about my daughters and their classmates. My daughters just started 3rd grade. It's a challenge that we need to be able to fix. And we need to be creative in our solutions. So you're not going to be able to legislate away a challenge like this, but you can move the ball forward a little bit. There are some means of providing something like a Narcan product where we have parents who will have the ability to be responsive while waiting for help. I think that we have young students, we have young adults, and even older adults who feel like they don't have the right setting to be able to share their challenges, to be able to get help and talk to peers, whether it's feeling isolated and alone, not knowing who to talk to. Maybe when you do know who to go to, they are talking about medication as far as treatment. Medication alone isn't the right answer for a lot of people who are struggling. We use, with regards to our veterans with post-traumatic stress disorder, a peer-to-peer model. We started in 4 counties, we've expanded it to 12 counties. It's a model for veterans of post-traumatic stress disorder to be with other veterans, their peers, to understand what it is that they're going through. I think that many of our children, young adults, and adults can benefit from using a peer-to-peer model. Again, you're not going to be able to legislate this at any level of government. We did pass a couple dozen pieces of legislation. If I was to think of 2 things off the top of my head, one would be to assist with the education and the distribution related to Narcan. And secondly is to create the right settings in our communities for those who are struggling with these challenges, to be with peers, to be able to talk about what they're going through and get help other than just getting medication.
Like recovery community centers?
Well, so with the veterans model, it's actually outside of, they're meeting wherever venues are being offered. They're meeting at maybe a veterans post or a church. There are a lot of different settings. I don't know if I personally would want to narrow it to any one in particular, but we have community recreation centers in towns all throughout Suffolk, owned, run by local towns, so they can be made available as well. But getting the right venue and getting awareness raised, and encouraging them to come out.
Why can't we consolidate all school districts for Long Island instead of having 101 superintendent for 100,000 dollars each salary? That would be it's half money like.
Well, first off, I personally believe that we have too many administrations on Long Island. We have 124 school districts. They all have their own superintendents, deputy superintendents, directors of math, science, social studies. They're all setting their own curriculum. There's a certain minimum curriculum standard that every school district seeks to obtain. There's a lot of duplication with regards to busing, payroll, finances. We can consolidate. It's up to local communities to want to consolidate. So
Save money.
Well, I would tell you that there are a lot of people who agree that there should be the consolidation administrations. I'm one of them, by the way. I would support that. I do support consolidating administrations. If you go to some kind of a regional approach, listen, not all school districts are equal. Brentwood School District has 13,000 students. Other school districts are substantially smaller. But the local communities are going to have to want to merge with the local merge administrations. And unfortunately, the movement with regards to mergers you see are primarily out east with smaller school districts. They're willing to come together. You can save a lot of money. It would be more efficient. You can still maintain your local identity. Patchogue Medford can still be, the Raiders, and Wayne Floyd can still be the Colonials, but you can save a ton of money.
As a matter of fact, to do it, each individual person.
There's just a lot of duplication. You have a lot of administrations doing the exact same thing. And it costs a lot. Our property taxes, 65–70% of our property taxes are school taxes. And that money can go a long way. You have seniors literally choosing between oil in their tank or prescription medication.
When I need that 20 years ago, my taxes were $1,500. Now it's $10,000. Social Security was $2,000. Why shouldn't this property be owned and pay taxes for education? Why shouldn't everybody, according to their income, pay so much for education? Equal, larger basis, more money available.
Yeah. Well, I think that if you were, as far as financing school districts, you finance them in two ways. One is through property taxes, one is through aid that you'll get from the state government.
Everybody should have according to what versus parents.
First, I'd like to thank you for serving our country, okay? And my brother was a career man in the service, and my husband also served in the service, so to me, that's really important. Okay, but I'd like to, my brother's in the Army, my husband was in the Air Force. Okay? Okay. And what I would like to ask you is about immigration. People who walk across our border, not only from South America, they can be from any country. How do we know they're not terrorists? Look at all the places that they're just popping up and all these weird kinds of things keep happening. It's really out of control, and our government does nothing about it. I mean, anybody can walk across any border.
So I strongly believe that we need to do a better job securing our border and also securing our entry process. There are many ways to come into this country, one of which is through our borders. We have a lot of unaccompanied immigrant children reading about in the papers. They're coming across the other southern border. Many are coming to Long Island. You have Central and South American parents who are turning their kids over to coyotes because they are under the understanding that if their children make it to the United States, they will be granted amnesty. These children need to be detained humanely at the border and expeditiously reunited with their families back home.
You know, they tell you how poor they are in all these countries. We give their countries millions and millions of dollars in aid. Who gets the money? And if these people are so poor, how did they get $7,000 to $10,000 for each child that they're supposed to be paying, or that you're hearing that they're paying, to assist their child to get to America?
Yeah, I would say that there's a lot of children all around the world who are suffering with oppression and poverty, and we all can have compassion for their plight. I would argue that our nation does not have the bandwidth for every child in the world suffering from oppression and poverty to come to the United States, especially without their parents.
And what about the children who are really born here and are American citizens, and they get sort of pushed to the wayside, and everybody else who comes gets everything taken care of? They get all their medical paid for, they get their hospitalization, they get money they get food money, they get housing expenses. Every time you turn around, you're seeing in the paper and you're reading about all these additional things that we're giving to them.
You know that it is legal. You know that EBT cards, electronic benefit transaction cards, We passed legislation every year in the New York State Senate called the Public Assistance Integrity Act. The Assembly would not bring the bill to the floor for a vote. We did something in this year's budget finally, and that's going to be something that's something that walked in. There was an agreement with the governor and the Assembly and the Senate. It is legal with your EBT card to be able to purchase lotto tickets. There are people who are legally getting tobacco and alcohol. And I think that it causes a lot of increased resentment amongst taxpayers who are struggling to make ends meet. You want to be able to help people who are in need. We all have that. It's human nature. You want to be able to give a helping hand. It helps us sleep well at night. But there are people who are taking advantage of the system. There are people who are unemployment who are working they're trying to get a job. They're interviewing, they're trying to move out of the situation that they're in and get something better. There are other people who are collecting unemployment who are perfectly capable of going out and working, but they're not even searching for a job. And you know that some of these systems, the way the system is set up, there are families who are in the Medicaid system. If they go out and get a job, they will lose their Medicaid coverage. So they do the math of the benefits they get for not working. They actually see a disincentive for going out and taking a job. And the fact is, if you want to work your way up the ladder, if you want to rise out of poverty and be able to provide better for your family, you're not always going to be able to start off with a nice, six-figure job. You have to get it back out to the workforce and out of the house. But I think too often we paint people who are struggling with the same brush. You have some people who are taking advantage of the system, and it's draining taxpayer dollars, and it's causing resentment.
Can I?
Lou has another question.
This is just actually, it's kind of interesting, this is following with healthcare, we talked about Obamacare. And about 8 months ago, my dad was thrust into the healthcare system, he had a stroke. You realize how bad the healthcare system is. I don't think it's bad because of Obamacare per se. I think Obamacare could have been made a lot better if we had a lot more cooperation on both sides. We do have certain states in the United States who use something similar to Obamacare. So I guess my question to you is, are you saying that you would like to abolish it completely, or would you like to rip it down to the bare bones and then build it up to something better than what it currently is? I'm just curious.
So I would say, a couple components of Obamacare, one related to we have people with pre-existing conditions who are now getting coverage and weren't able to get it previously. That's good. You have children who are able to stay on their parents' policy until they're 26, which is good. You have a lot of individuals in the 1st Congressional District who are losing their doctors. That's not good. Some of the longer wait times. For some folks, premiums have gone up, but deductibles have drastically gone up. So some people are having to pay thousands of dollars before their policy is kicking in. There are a lot of different solutions being discussed right now as far as alternatives. With regards to the pooling policies for small business owners, that the employer mandate's about to kick in. You have jobs being converted from full-time to part-time. There's something with a 40-hour work week that changed with Obamacare. They're needing to allow for the affordability of policies across state lines. That's something that's being discussed in the alternative. I also think that within Medicaid, we need to make reforms that allow individuals in the Medicaid system to be able to obtain the right coverage for them that they don't risk losing if they go out into the workforce and they're making more income. That's an important reform as well. Some of the solutions include tax credits for families who are struggling to make ends meet, to assist them to be able to go out and purchase their own coverage. Not everyone qualifies for Medicaid if you're struggling. A lot of people here on Long Island may be working, maybe making $80,000 a year. But if you own a home, you're married, you have 2 kids, $80,000 is pretty, you could argue that that's poverty on Long Island. That's the poverty line. You're struggling to survive with that kind of money. So I think that needs to be factored in as well with these alternatives, because making $80,000 in, in some Midwestern state where the average income is half of what it is on Long Island, what we see sometimes is, and it happens to Albany and it happens in Washington, we feel like we're getting less back than what we send to our governments. And I see it up in Albany. My colleagues upstate are convinced that every single one of you are filthy rich. Like they just, if you live on Long Island, according to some of them, you're all rich. And I think that you see a lot of that in Washington too, with the policies that get advocated, where they pick a number, they pick an income level, but it's not factoring in cost of living. So I think that needs to be factored in as well. As far as Obamacare goes, I hear nothing. A lot of folks complaining about their policies being canceled. I'll say a lot of folks who lost doctors. It happened for several reasons. Some people are losing their doctors because of reimbursement rates, practices reducing scopes, the amount of available networks being reduced. For a lot of practices, they built up the practice. They're selling the practice to North Shore LIJ. They're just giving up. For an OBGYN who has to spend $250,000 a year just on a medical malpractice, they're going to reduce their scope or move out of state. So I think that there are a lot of reasons why people are losing their doctors. But there's also a component of grandfathering in or lack thereof with a lot of policies. That's why a lot of folks they're losing their policies, they're getting a new policy. I think there are a lot of kinks to be worked out. There's a story, of the person who lives in East Quad when he is married with his wife and they have 3 kids. They went to the state exchange to buy a policy. They were able to find a policy for him and his wife, 2 of their 3 kids, but not the 18-month-old. So they went to the private market for the 18-month-old. They realized that they're able to get a better policy for the 5 of them. In the private market, they're getting a policy for the exchange for 4 of them and buying a private policy for the 18-month-old. So there are a lot of those stories too that are just kinks that I think need to be worked out. It's complicated, but I want to be part of solving the problem. And anyone who says that Obamacare is it's great, there's so many testimonials I hear every single day as I travel around this district for people who have been negatively impacted. I'm not going to argue, I'm not going to suggest that 100% of the people you go out there and talk to are going to agree with me, but I hear a lot of people complain about Obamacare.
Yeah, I think if it's.
We do have our time really is up now. We appreciate your time, and we know there's other candidates, and we also have our Suffolk County police officer to go back on duty. So we appreciate the time, and if anybody else wants to speak to candidate outside, you're more than welcome to. Thank you very much.
Thank you, everybody.